Obesity is a huge problem in the US, in both humans and pets. And a recent study reported that 62% of cats, believe it or not, are overweight or obese. I see people that say, he's a fat cat, he has such a quality life, which is actually the opposite. And overall, obese animals have a decreased life expectancy of about 2.5 years.
Hey everybody, thank you so much for tuning back in. We've got a great episode for you, sponsored by Hill's Pet Nutrition and featuring Dr. Lisa Durso, here to talk about the role of nutrition when it comes to feline health. So for me, I really had this light bulb moment when someone explained to me just how closely intertwined a cat's feeding behavior is with their overall mental and physical well-being. And if you listen to the podcast, you may have heard me talk about this before because it just was such a light bulb moment for me. We talked about how hunting isn't just about eating, it's about movement, it's about mental stimulation. So if we think about cats out in, the wild, so to speak, their natural behavior would be to hunt and eat multiple small meals throughout the day. And for every successful hunt, there would be several unsuccessful attempts, which would again provide mental stimulation and burn calories. And then there's also some considerations around what they're eating. So when we think about kind of that natural rhythm, so to speak, in cats, it kind of speaks to the importance of certainly what we feed our cats, but maybe just as importantly, how we feed them and how profound the impact of both of those considerations can be on their overall health. Now, for some cats, certainly, 2 more spread out meals of kibble work fine for them, and they tend to do okay. But others may need a different feeding style or type of food in order to maintain their health and well-being. And some of this mismatch could play into reasons why we see issues like lower urinary tract disease, obesity, diabetes, and more. So in this episode, Dr. Durso and I dive into feeding strategies that support both physical and behavioral health, and also, very importantly, how we as veterinarians can help clients make thoughtful, realistic choices for their cats when we get that inevitable question, what should I feed my cat? Let me tell you a little bit more about Dr. Durso and we'll talk about it. Dr. Lisa Durso-Keel is board certified by the American Board of Veterinary Practitioners in canine and feline practice and has a special passion for feline medicine. After graduating in the top 10% of her class from Mississippi State University College of Veterinary Medicine in 2014, she completed a rotating internship at Mississippi State, then relocated to Texas with her husband, an Air Force pilot, where she spent several years practicing emergency and general medicine. In 2020, she transitioned to feline exclusive practice under the mentorship of renowned feline expert Dr. Gary Norsworthy. In 2021, she became a diplomate of the American College of Veterinary Practitioners. Today, she practices in Virginia and brings an added level of expertise, having earned board certification, as well as having completed additional training in ultrasonography, dentistry, and acupuncture. She's also the lead editor of the upcoming 6th edition of The Feline Patient, due out in 2026.
Pet parents are looking for a veterinary practitioner who can prove they understand and support the relationship they have with their pet, show you value your client's trust, and earn an official human-animal bond certification from NAVC and HABRI, the Human-Animal Bond Research Institute. This certification, appropriate for all members of the healthcare team, explores the scientific benefits for veterinary staff, owners, and animals, and discusses how to establish and promote a strong human-animal bond. Enroll today at VetFolio.com.
All right, everyone, thanks for joining us. I'm very excited to be joined by Dr. Lisa Durso. Lisa, thank you so much for joining me.
Thank you for having me. I'm really excited to be on this podcast and go through this amazing topic. It tends to not get enough publicity, so I'm excited to talk about my favorite thing, which is cats.
Yes, I'm excited too. I was just thinking, I love talking about cats, and I feel like, I don't know, maybe it's just a perception in my head, but I'm like, I haven't talked about cats in a while. So yeah, I'm really excited to jump in.
Yes, yes, me too. And, I love this topic because we tend to really focus on older cats, like kidney cats or those with intestinal disease. So the young, healthy cat that's more prone to urinary issues and obesity, they tend to not get enough time in the spotlight. So I think it's a good time to shine on them.
Absolutely, absolutely. Because, urinary issues, especially in otherwise young, healthy cats, can be really serious. We're talking potentially life-threatening issues here. So I'm glad that we're going to jump into it. And kind of like you mentioned, feline urinary issues. And we know that urinary issues can be really closely tied to diet, really diet, and not only what food they're eating, but how we're feeding cats can be so closely intertwined with so many aspects of their health and their well-being. So let's start there. Can you talk about what food we feed them and how we're feeding them and the influence on their overall health?
Yeah, definitely. And I think when we talk about feeding, feeding a cat is integral to their health and well-being in so many ways. Outside of the nutritional aspect, I think we really need to have a discussion about how we feed them because it provides a lot of opportunity for enrichment for these guys. And whenever we talk about cats and their well-being, I really like to give a shout out to a resource that's out there from the Ohio State University called the Indoor Pet Initiative. They have a ton of helpful tips for veterinarians and pet owners that will help understand cat behavior and allow them to incorporate different tactics into improving their cat's well-being in their home. This is such an important topic because about 66% of US households have a pet. And I hate to say it, but dogs are slightly more popular than cats. So more households have dogs than cats, according to a recent 2025 Forbes article. But more than half of these households actually consider their pet to be as much as part of their family as a human family member. So this is where we as veterinarians can be really impactful in educating owners on how to keep their pets happy and healthy. It's a great time to be a veterinarian because everyone has these pets and we can really show how helpful that we can be. And feeding is one of those topics I get a ton of questions about in practice, like how do I feed them? What do I feed them? What is going to be best for them in the long run? And one of these ways that I really like to talk about in feeding to basically help provide enrichment for these guys is to think about what these cats would do in the wild. So cats in the wild spend about 52% of their time sitting and waiting, and then 38% of the time actively hunting and patrolling. Whereas your typical indoor household cat has a very sedentary lifestyle and they are preying on, a bowl of food whenever they want or depending on your schedule. So I really try to recommend to mimic the lifestyle of an outdoor cat because this strategy by itself can really help reduce the risk of obesity and curb stressors that manifest from having such a sedentary lifestyle, like inappropriate or behavioral elimination. So that's, a really good kind of starting point. And I know we'll dive into different strategies here in a little bit where we can talk about ways to incorporate that into their daily life.
And I'm so happy to hear that that's kind of the conversation that you're having with owners when they're, well, one, I'm also happy to hear that pet owners are asking these questions about, what do I feed? How do I feed? Because these are really important questions. And I'm excited to hear that's the conversation you're having because that's also the conversation that I'm having in the exam room. So that feels very validating to feel like I'm on the right track there. And you mentioned, the pet owning households in the United States. I think that really speaks to the importance of this topic because sometimes I think there's certain people there's a lot of people who have had cats their whole life and they're like, this is not my first rodeo. I've had cats. I kind of understand them a little bit. But there's others who say, I want to get a pet. I don't know if my schedule is conducive to a dog. So I'm going to get a cat without maybe necessarily understanding cat behavior and their subtle little nuances and thinking maybe they might be easier. In some ways, certainly they are, but they also have really important considerations that I think we need to be keeping in mind to keep them healthy, keep them stimulated. So, an important conversation on so many levels just to really create the best situation, the best quality of life possible for these cats.
Yeah, I agree. I'm glad you're having those conversations too. It's a wonderful topic that doesn't get touched on enough, especially, when we're moving from appointment to appointment so quickly. So I'm glad you're doing it as well. I have so many people that come in and they were like, "Oh, I thought cats were supposed to be the easy ones." And
Right.
it out, there's so many different quirks and things that we're learning. And, I'm really glad to see a surge in the research that's been done on cat behavior and just cats in general over the past couple years. I think they're finally getting the level of attention that they deserve. And, we've come such a long way from the cats are small dogs notion that
Yes.
so many were taught.
Yes, and if you're like me, who I don't have a cat, I've never owned a cat. I was allergic when I was younger. My husband's allergic now, so we don't have a cat. They teach you that in vet school. They say cats are not small dogs, but what does that actually mean? And I don't know that we had a lot of good answers to what do you mean they're not small dogs? But I agree with you. More recently, we are seeing a surge in the research. And like you said, what a time to be a veterinarian. We're seeing options and information that we've never had before and finding ways that we can really do a good job with these patients.
Right, right. I agree. I agree tremendously. And I think, the more research that comes out, it can cater to the uniqueness of cats. They definitely have really unique nutritional requirements. And I think we've seen a change in the diets over the past couple of years. So that's one way that we can separate them from dogs and really, enhance their well-being and help, manage or prevent illnesses that they are prone to getting. That brings us to a really good segue in what we can talk about as far as like their requirements and what makes them different from other species and talk about that next.
Yeah, absolutely. Because they do have different nutritional requirements compared to dogs. And so, yeah, let's dive into that a little bit.
Perfect. So domestic cats, they are obligate carnivores and they require nutrients that are naturally found in animal tissues. And if we think about, what wild cats or outdoor cats consume, naturally, they're going to pick small mammals, birds, reptiles, invertebrates, just based on the availability, but definitely their preference is the small mammal. And the daily energy intake of free roaming feral cats, whenever they're studied, they get about 52% from crude protein, 46% from fat, 2% from carbohydrates. And when people way smarter than me have studied cats in a laboratory environment, they regulated their intake to be really similar to the feral cat that's out there. So their target consumption when offered various can and dry diets was about 52% protein, 36% fat, and about 12% from carbohydrates. So their protein content was, essentially the exact same. But I think when we talk about proteins, it's important to note that it's not just the protein content in general. Cats have really particular amino acid requirements, and they require a higher quantity of things like arginine, taurine, tyrosine, and cysteine. And I am by no means a nutritionist, but I can tell you, a little bit about these amino acids and why they're important for cats in general. Arginine is an essential amino acid for cats, meaning they can't produce it by themselves and they must obtain it from diet. And this one in particular is really important for protein synthesis, blood circulation, and ammonia metabolism. So without it, they can develop severe health issues like ammonia toxicity, gastrointestinal problems, neurologic problems. Taurine's been a fan favorite that, we were taught about in school quite a bit, and it's essential for heart, vision, and reproductive health. Taurine deficiency can lead to dilated cardiomyopathy and heart failure and retinal degeneration. And I think we know a lot about that. That's been studied pretty heavily. I learned recently a little bit more about tyrosine, which is another essential amino acid that plays a vital role in various bodily functions, like the production of melanin, neurotransmitters, and thyroid hormone. So a deficiency in tyrosine, it can take a cat that normally has a black coat and turn it into a reddish brown color, which was a unique thing I learned at the ABVP conference that was last month.
Interesting.
Yeah, super interesting, right? And I think we've all kind of seen that, cat that has a color change and you're like, well,
Yeah.
I don't know what to make of it. Or if this cat's on chemotherapy, you blame it on that, but it could certainly be a deficiency that we just didn't know about. My last one that I mentioned was cysteine. It's an important sulfur-containing amino acid that contributes to protein synthesis, hair and skin health. And cats are interesting in this regard compared to other species in that they have a limited capacity to synthesize taurine from cysteine. So while cysteine is not considered a quote-unquote essential amino acid, it's really crucial for their overall well-being in many ways. So those are just like some key nutritional components that I've learned and wanted to share with you guys, over the years that make cats a little bit more unique as a species.
Yeah, absolutely. I think that's a really important consideration, thinking, not protein not is not protein is not protein. We need to make sure that they have amino acids available depending on what they're eating in order to be able to have all these normal bodily functions, including coat color, which 100% I have seen that black cat that kind of like, as they get a little older, they start to have a little bit of a color change. So yeah, I'm going to keep that in the back of my mind for sure. I'm curious, when we're talking about cats, of course, being able to tolerate much higher protein and fat concentrations in their diet and probably a little bit lower carbohydrate level, how do you talk to owners about the form of food that they're feeding, like canned versus kibble versus like home prepared or something like that?
We're in the day and age of there's so many different options out there on the market. So I think it's important to have that conversation. With a homemade diet, I certainly always recommend for them to have a consultation with a board certified nutritionist, because I don't know about you, but I did not get nutrition in vet school.
Not to that level.
Yeah, definitely not to that level. So I'm always going to recommend, like, gold standard, you go to a nutritionist if that's what you want to do. I can barely feed myself dinner, so I am not cooking
Amen.
for mine. But when we talk about like variety of diet, I definitely like to stick with companies that, really have a bunch of science and research put into their diets. They're the ones that research the spectrum of amino acids that cats need. So diets that have the scientific, basically research behind them, definitely going to be more apt to recommending those, or those that have been through AFCO feeding trials. They're really important to talk about and recommend. And in general, I see a lot of elderly cats that have never seen canned food, for example, like they've been fed dry food their whole life. And then the owner's like, well, he won't eat it. So then we get to have a fun conversation on something unique that cats do called imprinting. And they actually tend to imprint on their food whenever they're very young, like early in the weaning period, sometimes between like 4 to 8 weeks of life. And then their preferences are set in stone by about 6 months. So during this time, we recommend offering a variety of combination diets, like different textures of canned food, different kibbles. So that way they have choice and they know that that food is safe and it can help owners later in life if the cat ever requires medication. Like sometimes we can be really sneaky and put meds in their canned food, but exposing them to different things while they're young, it can help encourage kind of like a wide variety of consumption for them. So that's a fun conversation and good for trivia night in case you ever get a question.
That was such a light bulb moment for me when someone explained cats imprinting on food. And it also contributed to this conversation I have with owners in the exam room, and they're asking about feeding. I've joked on the podcast before that, whatever technician I'm in the exam room with, just you can like see them just like stand back against the wall and they're like, here we go. We're going to be here for a minute. But yeah, when someone explained to me, like, if you feed the cat only brown circles, the cat will think only brown circles are food. And it's going to be really hard to change that later on. Recently, I was talking to someone and they recommended when you're trying to change diets, if you do have one of these cats that's really imprinted on their food, offering the old food and the new food side by side and giving them the option and that kind of helping the cat learn that this is a safe food. I can go ahead and eat this.
Yeah, yeah. And cats are so interesting, and repeat exposure can be helpful, of course, unless they're burying their food. But the way cats experience like taste, textures, and smells of edible food, they actually use their olfactory system quite a bit in food selection. It's actually their primary way to select food. And I also learned recently that their olfactory system is about 14 times stronger than humans. So that was pretty amazing. And, we know that they use their nasal organ, the upper lip flap and like the
Right.
mouth open when they look really silly. So they use that to detect and select food and also decide if it's safe and fresh for consumption. And interestingly, if the smell is not overly appealing, then cats tend to actually use taste as a secondary line of assessment to see if they're into it.
No kidding. So they'll give it a second chance.
Yeah, exactly. So they might lick it and then be like, nope, not my not my style.
I think we've all seen cats do that where they go up and they sniff it and they're like, I don't know, maybe. And then they lick it and then they walk away. And you're like, okay, well, good thing I got a whole case of this.
Right, exactly, exactly. So, something else that I like to talk about too is cats tend to show a feeding preference for umami flavors like savory or meaty, which really kind of plays into their protein needs because those tend to be higher in amino acids and have different nucleotides and mixtures there. Another fun fact about cats while we're on this subject is they are indifferent to sweet items because they don't have the pseudogene for one of the proteins required to form a functional mammalian sweet taste receptor. We don't know much about salt in cats, but it's thought that they don't really have a preference. So that's kind of interesting as far as like flavors to go by. And something else that I recently, in diving into some research about this, I learned that cats older than 7, they start to have a temperature preference for their food as well. So they want it closer to body temperature versus refrigerated or room temperature food. So they tend to want it heated up a little bit.
No kidding. All these things to get these cats eating when they start to get picky. I'll take all the tips and tricks. That's good to know.
Right. Who knew? I mean, cats were supposed to be the easy species, right?
I think we are rapidly learning that nope, they're just very good at hiding a lot of things.
Exactly, exactly.
It's interesting. You mentioned the salt that we're not really sure as far as their preferences with salt.
Mhm.
Is there any information that you're aware of with salt, I guess salt content in the diet? Just thinking from the standpoint of cats really not being the best water drinkers.
Yeah, yeah. And you bring up a really good point there. Water consumption in cats is very interesting as well. I can't tell you how many times I've been in an exam room with an owner and they're like, oh, I've never seen my cat at the water bowl. He doesn't drink water.
Right.
Those types of things. And cats really retain a lot of characteristics from their desert ancestors, which is the African wildcat, which excel at low water consumption and do a really good job at producing very concentrated urine. Cats tolerate dehydration better compared to other species. There was a questionnaire that was sent to pet owners about water consumption, so we could learn a little bit more about what the owners are seeing at home. Cat owners reported that cats largely prefer their water to be away from their food source. Water fountains, which I know are a big hit in some households, was really a very individual cat preference there. Turning on the sink, we definitely see our sink drinkers. They're up there hanging out, wanting every sink to be turned on. That was an individual preference. But most cats largely still prefer to bowl. And for whatever reason, cats tended to prefer a smaller bowl compared to a larger bowl. And there was a postulation, associated with this that cats could feel the edge of the bowl with their whiskers, with the small bowl compared to the larger bowl. So, that was thought to be the reason that they liked it. Tap water was preferred. However, if you live in an area where the water is heavily chlorinated or mineral dense, then either filtered or mineral water may be preferred there. Cats really, of course, they aren't the best water drinkers. We see that quite a bit, with their urinary issues and kidney disease. So a lot of my conversations in the exam room when we focus on water consumption, I try to give owners some tricks to encourage water consumption by adding, a small amount of water to the canned food that they're going to serve, mix it in really well to make it more soup-like. So many cats will consume a little bit extra there. Some other sneaky ways, I know many owners will like to cook for their cat, or say if they cook meat and they take the homemade broth from there, they can offer that to cats to have a little bit of an extra appeal to it. That I will say we have to be cautious in our cardiac or kidney cats, although the salt content's pretty negligible whenever they do at home cooking, as long as they're not adding a bunch of different flavors and spices there. But something that's been really surprisingly successful is if you have that bowl of water and it's been in the same place for a really long time, if you just move it like 6 inches over somewhere else in the house, the cat's gonna say, "Oh, hey, this is new. Let me go check it out." And that'll encourage
No kidding.
more.
Oh my goodness. Cats are so funny with their strange idiosyncrasies. And yeah, and all these actually, I thought I had some good tricks in my toolbox for getting cats to eat and drink things, but I feel like I'm picking up so much from what you're going over here. That's all. I mean, these are all such easy changes that owners can make to really encourage cats to drink water, because certainly that will hopefully help some kidneys later on. Also, it was news to me that they descended from African wildcats, and I was like, I actually don't know what that is, and I Googled it. They look just like house cats.
Oh, I know. I know.
That's
Isn't
wild.
it
So yeah, if you haven't ever Googled African wildcat, please do. It's like the fun fact of the day.
Yes, yes. I'm glad you're learning so much. That makes me really happy.
Absolutely. Absolutely. Well, let's keep talking about it. When we started our conversation, we talked about kind of normal cat feeding behaviors and how they sit and wait and then they hunt this prey. So along those lines, can you talk about some tricks for can you talk about some tricks for feeding cats in ways that will, of course, be beneficial to them physically, but also mentally?
Yeah, absolutely. Absolutely. And this is another kind of fun conversation that you can have with the owners. And it goes back to kind of mimicking that outdoor cat lifestyle. So if we take cats in the wild, they typically consume multiple small meals, varying sizes throughout the day. I always tell my pet owners in the exam room, I'm like, yeah, if it was up to them, they would have 12 little mini meals per day, which is the same with me. I would love that as well.
Sure.
But some strategies that we can use to help mimic that, and some things that have been really life-changing even in my own household, is actually having the dry food in a timed feeder. That has been great because you can set it at different times. So say if your cat is trying to wake you up at 3 a.m. in the middle of the night, that's when you can have your timed feeder in a separate area of the house go off. And that way the cat will kind of disassociate you with the dry food. So that is a nice little trick. I have mine go off, where it gives a small amount of food about 4 times per day. And then I serve canned food at specific intervals, and the cats very much know whenever that time is coming up. So I think the time feeder can be so helpful. I also think, if you're really invested, you can even put kibble into a treat dispenser where the cat can work to get it out. And that is going to provide much more mental stimulation. Of course, they need to know how to use that treat dispenser. But something else fun is you could move it to separate areas of the house, or you could have like two or three. And that way the cat can seek it out, hunt it, and then get that kibble out. And it's going to provide some mental stimulation as well as movement, more movement than they would be doing, rather than sleeping on the bed in the closet, being a little couch potato there. So that can help some exercise. I know that there's some veterinarians out there that advocate for getting rid of bowls for dry food completely, using those dispensers, or, mouse shaped, like a mouse shaped dispenser or something like that. So, those are some tricks and some options. I think that timed feeder is really the way to go for, practical families, because not everyone is home and able to feed their cat, 12 little mini meals. But if you can have something go off and it separates you from the cat, I think that could be really instrumental, especially for those kitties that love to wake you up in the middle of the night.
Absolutely, which, again, I don't have a cat, but from what I understand, talking to many, many cat owners, is most of them will
Yes.
wake you up in the middle of the night or at 4 o'clock in the morning and say, hey, by the way, it's time to eat. Also, I've found when talking about timed automatic feeders, I have to be very specific when I'm talking to owners about that, because what I was about to say is I don't know what we did before these automatic feeders. And what I've found when I talk to owners about, well, hey, you can use this timed feeder. Sometimes automatic feeder has gotten confused with like a gravity feeder. And like, no, that's not the same thing. You want something that's going off periodically, so the cat is attacking and bothering the feeder at 3 o'clock in the morning, not jumping on your head. Uh,
Right.
and yeah, and it seems, really beneficial to the cats, especially because many cats are indoor, which of course is really beneficial for their overall maintaining a good quality of life and staying out of danger and out of trouble. But if they are kind of in this same place for their whole life, doing these treat dispensers and things like that, giving them that mental stimulation, that physical activity, it just makes sense that it would be so beneficial for them. And of course, when we are keeping them hopefully from getting obese and giving them that good mental stimulation, that's going to be really beneficial for urinary tract disease, which we also mentioned at the beginning here. So can we jump into that a little bit and talk about urinary issues in cats? And let's just start, we've talked a lot about diet. Maybe we'll talk about urinary issues and then how they relate back to diet.
Yeah, yeah. And I think that's a great topic to talk about because, we really are focusing on, at least in this talk, about our young cats. And urinary tract disease is very prevalent in our younger cats. And I think, when we think about the urinary tract in general, we have to think about the composition of urine, like concentration and pH, as major contributing factors for most of our common urinary tract diseases like crystalluria, uroliths, idiopathic cystitis or Pandora syndrome now, urethral obstructions. And this is really when we can talk about like who will benefit from a therapeutic diet versus who will benefit from an over-the-counter diet. So the urinary prescription diets, they are formulated to dissolve struvite crystals, maintain a desirable pH to reduce the risk of calcium oxalate crystals from forming. And they're also enriched with omega-3 and 6 fatty acids, which are really important in inflammation. These diets have controlled calcium levels, added potassium citrate, and controlled sodium levels. So these diets are really important for cats that truly have a diagnosis or a problem there, because it's going to promote a urinary environment that does all of those things that I just mentioned, versus a over-the-counter diet. Those are non-prescription products that really help support the health of the urinary tract. Most of these diets are paired with something like a hairball formula. And the diets, they have optimal levels of magnesium, so that helps support the whole urinary tract, but it doesn't have all the stuff that a prescription diet would. They often have higher fiber, fatty acids, and antioxidants to help support digestion, skin coat, and are really easily digestible. But like your perfect cat that could benefit from an over-the-counter diet is like if you have a owner that has had a cat in the past with urinary tract issues in their younger years, but this cat is not diagnosed with a problem. The owner's just hyper aware. They want to help support them in ways that they can. So that's really when, you could pull out that food product versus the prescription product. Ultimately, if we have a cat, say, with urethral obstructions, feeding the prescription diet is going to be less costly long term than treating repeat episodes of urethral obstruction or cystitis. So we always want to make sure that we offer that gold standard first. But say, I can't tell you how many cats have come in and they're like, oh, well, my prescription ran out. And I just started feeding the over the counter stuff. So, at the end of the day, clients are going to do what they're going to do, but we have to make sure that we recommend what's appropriate for that cat and who you're going to pick which diet for, if that makes sense.
It does. It does. Yes, I also encounter that with some degree of frequency of, oh, my prescription ran out, so I switched to this. Or I'm feeding the prescription, but I'm also feeding, these 5 over-the-counter canned diets on rotation. And I'm like, I don't know if it's going to work as well if you do that. Another case I wanted to ask you about for a good over-the-counter candidate are the owners who come in and maybe they have had a cat with urinary issues in the past. So they're hyper aware of it, like you said, but not in this particular cat. Do you generally think it's safe, reasonable to do an over-the-counter urinary formulation for owners who are just worried it could happen down the road?
Oh, yeah, for sure. 100%. I think that is a great option for them to consider, especially if you're talking about like a young, overweight male cat. I think we always have to worry about their urinary tract. Or, our female cats, we'll talk about weight in just a second, that are a little overweight and, we're worried, are these girls able to groom back there? Are they going to get a UTI? What is that looking like? So I think anything we can do to help promote urinary tract health in our younger cats, because that is such a common problem for them, I think it's a great idea.
Sure, absolutely. And you mentioned weight and jumping into that. I think that sounds good because certainly, a lot of times when we do see urinary tract issues, whether it's the blocked male cat or the female cat with a UTI, we are seeing overweight cats. So how does weight factor in these cases?
Yeah, and that's a great question because obesity is a huge problem in the US, in both humans and pets. And a recent study reported that 62% of cats, believe it or not, are overweight or obese. Cats aged 5 to 10 are most at risk for obesity. We as a society have really done a disservice to our indoor cats, because a lot of times, like, I see people that say, oh, he's a fat cat. He has such a quality life, which is actually the opposite of what he has. So, by having an obese cat, we're really setting them up for failure in a number of different ways. Obese cats are 2 to 4 times more likely to develop diabetes. They're at higher risk for urinary tract infections, perivalvular dermatitis, since they can't groom. And overall, obese animals have a decreased life expectancy of about 2.5 years. So we're not setting them up very well. Obesity, in regards to the urinary tract, has been associated with increased excretion of minerals in the urine and susceptibility to urolithiasis. So, we really need to be cognizant of how we approach obesity, especially in our young cats. And I think, there's a big difference in with the owner that feeds the cat too much, when we talk about diets for them. So those guys just likely need to have a controlled amount of food that they are given versus cats with a slow metabolism. That's really when we want to pull out the things like our metabolic diet with the urinary component. That's where that would be a really good choice versus, a cat getting fed too much, because that cat that has a slow metabolism needs a little bit more than just calorie restriction as far as the amount that the owners are feeding. And I think, it's a great time to have this conversation at the time of either spay or neuter, or when they come in for their annual exam, like right after their kitten series, to have that conversation about, how do I maintain a healthy weight? What is this cat's body condition? What does it look like? And you can use the semi-objective 9-point body condition score, or BCS scale, to notate that in the file, so you can grade them year by year and just see how they're responding to that food, or if we have to make changes. But I definitely want to make sure, I say that we should also add muscle condition scoring as well, because it's important to know like what that looks like, because you can have a cat that has an underlying illness and we have a reduced muscle mass, but it can still be a chunky cat. It can have a big old fat belly. So, that having that lost muscle mass, that may trigger, a workup for a different condition. And, when we talk about weight management and nutrition, WASAVA has actually a great nutritional toolkit with surveys, guidelines, and tools for owners, so you don't have to reinvent the wheel when it comes down to it. And, that being said, another really wonderful resource is the petnutritionalliance.org. It's a great website that can help you calculate the amount of calories that pet needs, because their maintenance energy requirement, it is influenced by a lot of different factors, like our resting energy requirement, exercise, the thermic effect of food, meaning the energy used during digestion and absorption, adaptive thermogenesis, which regulates body temperature or their response to the ambient temperature. So there's a lot of things that go into play, and just taking the workload out of calculating things out by hand. I've sat through several lectures that say like calculating it out with the owner by hand in the exam room can be really helpful, because they see that you're invested in their cat's well-being. But the time commitment for that, it can really add up. And if you are in a busy practice, seeing appointments, every 15 to 30 minutes or so, like depending on your schedule, this website could be great. And it's fun for the owners because it's interactive. Like you can pick that your cat is like a 9 out of 9 and you want them here. So it's fun and interactive for them. So I think, all of those tools could be really important to use when we talk about obesity in cats. I also have a lot of owners ask about exercise. And, while exercise is very much desirable in cats, it's really difficult to achieve. We know that cats are not willing participants for many things, especially neurologic exams. They do not like to participate with that. But setting aside time to play with like a laser pointer or a toy for 5 minutes at a time, or assigning that job to a kid in the household, could be really helpful. I have some clients that have very successfully used cat treadmill, so that is always cool if they will do it. But it kind of ties back into if we can, move their food source, or kind of have them seek it out in a treat dispenser, that can encourage, some additional activity that they wouldn't normally be getting. So I think, obesity it's a big topic, and I think it doesn't get talked about enough, or it gets brushed off quite a bit. But, this is where we as veterinarians can really come into play for setting this cat up for success. And, if the owners are receptive to having that conversation, it's really worth taking that extra step and having that discussion with them.
Absolutely. Gosh, so many good points that you made there that I think are really important. I love that you brought up that some cats with a slower metabolism that are just obese prone, they may need something different. Sometimes we restrict those calories and we can actually restrict them too much and really do them a disservice. So doing things like metabolic diet, I love that suggestion. And then now we're finding out all these cool new things about the microbiome, and I'm really excited to see how that's going to influence these obese prone cats later on. And I think it's funny you bring up the time it takes to do the calorie calculation for the individual. That was literally me this week. And every time I look up the formula for calculating it, I'm like, I have to write this down. So I just have it at my fingertips, and I never do. So I always have to go back and look. I'm like, what is it again? It's 70 and something to the 3/4. And yes, that does make sense that it's a good tool to use with owners. But I pulled up these tools that you were suggesting while you were talking, the Wasava Nutrition Toolkit and certainly Pet Nutrition Alliance I'm familiar with. And you're absolutely right. There's so many good resources there that can still get the pet owner involved without maybe taking quite as much time in the exam room, which, we all know those minutes are precious. And then, overall, I think you just did a really great job of illustrating how much goes into keeping cats healthy, kind of like we've touched on several times, that what a time to be a veterinarian. We're learning so much. Cats aren't necessarily the easy ones. They need just as much care and consideration as any pet we might have. So Lisa, thank you so much for all of the amazing information. Any final thoughts you want to share with everyone?
Oh, no. I mean, just thank you for having me on the podcast. I really appreciate the opportunity to chat about this. This is, cats are my favorite species. I will always talk about them given the chance. So I loved being on here, and I think we touched on a lot of great points. I hope this helps a lot of the listeners.
Thank you to everyone who tuned into this episode. I love talking about cats and their idiosyncrasies. I just think they are one of the coolest species out there. So thank you to everyone for tuning in. I hope you enjoyed it and learned a lot. A big thank you to Hills Pet Nutrition for making this episode possible. Dr. Durso, it was lovely to have you on the podcast. What a great conversation. I really hope we can do it again sometime. If you enjoyed this episode, please leave us a 5-star review wherever you get your podcasts. It'll help other veterinary professionals like you find this and other great content we try to put out there. If you'd like to hear more episodes, you can click on the Education tab on the VetFolio website or find us wherever you get your podcasts. As always, we are eager to hear your thoughts and ideas for future episodes, so feel free to reach out to me at dvm@vetfolio.com. We can connect on Facebook at Dr. Cassie DVM, or you can follow me on Instagram at dr.cassie.dvm. And remember, if one animal is better off because of you today, it's a great day.